Yeah, I am somewhat filled with trepidation because I spoke with Phil Johnson before taking this job, and he said, "Oh, it was the best job in the world, and I would still do it if they let me." This is only my second appearance as Undersecretary, so I'll have to ask Lauren Peters to grade me in terms of. But I noticed that she looks stress-free, and I look very stressed. So. Phil is right in the sense that I've always been very concerned and very focused on patient safety as part of really what I think of as a patient experience. And I think that when bad things happen, it's sort of the tail end of a negative experience. But I've always been very interested in just how do we make patients feel at home. And obviously, harming our patients is really not a way to make them feel at home. I do remember, I do remember the first patient that I considered myself responsible, whose death I considered myself responsible for. I was an intern, and she was very sick and couldn't be taken to the operating room, and so the procedure was being done on interventional radiology, and I was there to make sure that nothing happened to her. And I could tell from monitoring her that she was just doing more and more poorly, but I couldn't bring myself to tell my attending radiologist to stop the procedure that he was doing. And after about 10 minutes, the patient coded, and then patient died. And just remembered, it's not that she would have lived much longer, but if I'd stopped the procedure, we could have gone back to her room, her family could have been with her, and she could have had an easy death as opposed to having a painful death in this sort of tube that we were both in the radiology room. And I think that's just a story, but events like that happen across the entire continuum of care, and it happens every day. And you know the numbers as well as I do, and better than I do. But patient safety is really something that has to be at the center of what we consider as healthcare. A great deal has been learned about sort of improvement science over the last 2 decades and how to incorporate safety. So it's not a question of knowledge. And we also know that no matter how much you've done in your institution, the work is never done. It's one of those things where truly the journey is what it is, and we'll probably never get to a place where we are where we'd like to be. But certainly where we are now is not acceptable. And there's no easy, quick fix. You all know that there's a ton of knowledge out there. You have many colleagues who are well-versed in this field. There are nonprofits that can help you. There are consultants that you can pay to help you do it. But there's no quick fix. But the roadmap to safety that you hear more about today really offers a sustained, phased approach for us to move together as a state, to move together towards a more safe environment for our patients. What is crucial for all of us, for all providers of care, is that we approach this as a need for a continuous improvement system. It is not addressing a particular issue that happens, or if you get sued, or if I show up at your institution and say what's happening, right? Yes, you have to do that. But really, it's about engaging in a continuously improving system, and those systems really help us keep on track and to help us engage our frontline staff and bring in leadership. This is not something that can be done only within the highest levels of institution as a protocol or a paper that you put in that drawer that you only open when the Joint Commission comes, right? This is really something that has to be integrated in the daily lives, in the daily work that is done at all institutions. I know, as having been CEO of the Federally Qualified Health Center, I know the number of priorities that pull on leaders on every day. There's only so much time that you have, and then there's all these incredibly red-hot fires that you have to put out. But nevertheless, the only way to truly have a system that's safe for our patient is to make patient safety a priority and to integrate patient safety within what we do. If you think of some of the challenges that we're all facing, like the disparities in safety and other health outcomes that are based on race, ethnicity, disability, and other markers, if you think of our desire to improve patient engagement, And if you think of what is really the number one thing now in everybody's mind, which is workforce. How do you engage people? How do you retain people? How do you inspire the next generation to come into the field? All those things rely on having a safe culture and a safe environment. Improvement obviously also needs accountability. For healthcare providers, yes, but for all levels of the sector. And what this means really is at every level, everybody has to be involved and has to be involved in holding themselves accountable, but also holding their partners accountable. So the provider organizations really is our responsibility within part of organizations for the leadership to understand and carry that message of patient safety, and to make sure that you're making safety a core value of what the institution does. And I'd also say that it's important to invest in improvement. Well, people will say, well, yes, but I don't have any money to invest. But what I do know as a leader is everybody is always watching what you're doing as a leader. And even if you're just investing your time in paying attention to patient safety, it makes a tremendous difference when people know, oh, the leader is actually chairing this particular task force. The leader is following up on this particular initiative. It must be important. It also is important for industry and professional associations to offer resources to help providers reach that next step. It's important for payers to really incorporate the concept of patient safety within the set of measures, within the expectations that they're setting for providers. And it's important for government to keep healthcare safety really at the center of what we are doing, of what we're looking at, of what we want to be leaders in the nation on. It is up to us to invest and coordinate resources. It is up to us to harmonize the state safety data collection. And it's also up to us to incentivize improvement. When I mention all those prior players, it really is part of the job of the government to incentivize all those players to really make patient safety a core value, a core priority. I want to recognize that the roadmap is not something that Barbara dreamed up in the last week. This is really the product of years of thoughtful collaboration among a really remarkable and diverse group of stakeholders. A lot of them are sitting in the room today. And while the roadmap to safety is a remarkable achievement and entails us really moving together, us finally sort of acting like an orchestra with the roadmap to safety being the conductor, the hard work still lies ahead of us. Patient safety is always going to be hard work. And although Massachusetts has made great strides, there still is a lot of work ahead of us. The Lee administration is very excited about this potential and is looking forward to joining this effort. So it is my honor to cede the mic to Barbara Fain, who is also in Phil Johnson's words legendary. And so thank you.